Corona vaccine. Drip run 2-day coronavirus vaccine starts today in the first step when the government launches the COVID vaccine. 30 crore persons are expected. The Moderna COVID-19 vaccine for use by Canadian authorities in individuals aged 18 or older has been authorized. 40 million doses have been requested by the government. Up to 168,000 of them could meet at the end of December. Vaccine delivery can start within 48 hours. Pfizer and BioNTech have signed an agreement with the United States that by the end of July 2021 an extra 100 million doses would be given for their vaccine, and the initial commitment will be doubled. The UK has sent approval to AstraZeneca and Oxford. Their vaccination is COVID-19. It is expected to be approved soon after Christmas by UK health regulators. In record time, the vaccine's COVID-19 hit customers. Although it normally takes 10 to 15 years, the United States in less than a year. The Food and Drug Management approved Pfizer and Moderna's emergency vaccines. In the earlier 1960s, the fastest ever mumps vaccine had been produced over 4 years. However, it faces possible obstacles to expanded development and delivery long after a vaccine is approved or licensed entirely, which also requires specifying which populations can receive it first, and at what costs. The United States Centers for Disease Control and Prevention proposed that first-dose healthcare staff and long-term care patients be administered, for individuals aged 75 or over, and that first-line employees be the next in line. The actual rollout depends on the decision-making of the administration. As of the 21st of December, 614,117 vaccine doses of COVID-19 were administered and 4.6 million doses were released. President-elect Joe Biden and others of the United States' highest leaders got their first public doses to prove their faith in the vaccines. But Robert Redfield, CDC Director, vaccine developers, and the FDA reported that vaccines will be impossible to be available by mid-2021. On Monday, the country announced that it had detected the first virus variant cases associated with a rapid rise in infections in the United States. The latest variant, believed to be more transmissible than those now circulating, was discovered in 3 persons who reached South Korea by London in December. South Korea officials pledged to accelerate their efforts on the start of a public coronavirus vaccine program. A winning formula for efficacy was created by the COVID-19 vaccinate founded by British drug company AstraZeneca and by the University of Oxford. Approval of COVID-19 vaccine Covaxin by Bharat Biotech may take time, as the Phase 3 studies are yet to be completed, although Pfizer is yet to present. In this way, the Covishield vaccine from Oxford is possibly the first vaccine to be produced in India. Interim results from Bharat COVID-19's Phase 2 studies. Meanwhile, Covaxin can produce antibodies that may remain effective for 6 to 12 months against COVID-19. Keep tuned for further updates. Elderly people in Mexico could get coronavirus in January. The second day of medical vaccines saw the Ministry of Health report 6,217 new evidence illnesses, and 400 more deaths, bringing Mexico's count to 1,383,434 cases, according to President Andrés Manuel López Obrador, before he relocated to inoculate elderly citizens, he said on Sunday. More than 60 vaccines are still being submitted for approval to regulatory authorities in a 3-phase trial process. Because of the pressing need, some vaccine researchers have concurrently compressed the therapeutic phase for SARS-CoV-2. So far there have been a total of 2,360 training sessions and 7,000 officials, including doctors and vaccinators, have been trained. Health Commissioner Katamaneni Bhaskar told reporters on Sunday in Andhra Pradesh that the dry run would be performed in the Krishna district to test the scheduled operations and architectural structures in the area. Like all vaccines, the COVID-19 candidates are specifically intended to train the immune system to install defenses that are often greater than normal pathogens and have lesser health effects. Traditional vaccines are used for this purpose in the coronavirus but in a killed or damaged case. Others use either a fragment or a protein of the virus. Any pass instructions to an unrelated virus that is impossible or unable to induce disease for coronavirus protein. In conclusion, state-of-the-art vaccines rely on the use of sections of the genetic material of coronavirus to allow our cells to produce coronavirus proteins required to stimulate our immune systems temporarily. Thank you guys so much for watching this video. If you liked it, like, comment if you haven't already. Meet you with the new video.